All right, we are officially live. All right, I'll give it a couple of seconds. Dr. L, Dr. Naima, you can hear me okay, right?
What?
Yes.
Okay. Don't start that mess. Okay. All right. I was supposed to select some moderators, so hopefully your moderators will join because I didn't get any Dr. L. Well, no, I did. I got two volunteers, and if they are on when oh, you know what? I can't do the whole full screen because I got to see the chat, right? If they end up joining, can I make them a moderator while we are live?
Yes.
Okay, so all right. All right. Well, thank you so much for Dr. L and I are reunited. Dr. L, we haven't done a show together in a minute. Did you break up with me?
I thought you broke up with me.
No, you broke up with me. So I was like, we haven't done a show in a minute. So welcome, Dr. L. Or should you say welcome to me because we are streaming from each other's YouTube page.
Welcome. Why you put our business out there in the street like that? I don't understand.
I love you, boo. Hey, Mimi. Thank you for joining. Thank you for joining. I'm about to put it in the chat. All right, today, y'all, we got an actual medical doctor. Dr. L is not a medical doctor. Okay, doctor. We love Dr. L, but Dr. L is a doctor by theory, right? By Dr. L by paper. Right, that you wrote some
No, no,
papers
no,
and
no.
became a
See
doctor.
the shots fired. See what I got to deal with all the time. I'm a doctor by practice too, right? So I'm not a medical doctor, but I did 24 years in policing, right? So that counts for something. So I
That
kicked
counts.
in doors. I
Absolutely, it
kicked in
does.
doors and did all that stuff.
You're right. You're
All
right.
right, all right.
Yes. Hey, Rhonda. Hey,
See that?
Miles
See
and
the
Yoli.
doctor Naima. See what I got to deal with all the time. See?
I
Yes.
see. I
We
hear.
we appreciate, as always, Dr. L, your masculine intelligence on the show. But today we have an actual medical doctor. So we want to continue the conversation that we had about the having sex. Remember that whole conversation where you were so transparent, Dr. L, when you was telling on yourself. And we might have that conversation again tonight, right? But we want to continue the conversation with some actual
This bus
medical.
got a lot of gas in it tonight, man. Go ahead, man.
I mean,
Go ahead.
because I haven't heard from you, and I'm like, okay, I've been looking at my phone. It's just been dry, Dr. L. I said, oh, he must have replaced me. I'm
No,
on giving up them
you
cookies.
you are deaf. Why? Oh my goodness. You are putting all of our business out in the street.
I love you, boo. Hey, Tamika, oh, it's so good to see you join the conversation. Hey, High Vibe. So we got a moderator. So thank you, High Vibe, for joining tonight. All right, but tonight, y'all, in all seriousness, we have an actual medical doctor, Dr. Naima. I'm going to have Dr. Naima Spradley introduce herself. So you go right ahead, Dr. Naima.
Hello, hello. My name is Dr. Naima Spradley. I am a board certified family medicine physician. I've been practicing for over a decade, and I am the CEO and founder of Refresh Health, which is a medical practice here in Laurel, Maryland, where I'm located. Outside of my medical practice, I absolutely have a passion as a burnout coach. So I help overachieving, high achieving Black women to break free from burnout because I was that girl. It took me down pretty bad. So I'm just so humbled to be able to help other women to break free and to live the lives that they envision, because it's about living a soft life. We're tired of the hard life, so I'm just grateful to be able to use what I was meant to do, and my purpose in life.
I hear that. I know I'm tired of the hard life myself. I see you, Garrett. Hey, Garrett. I haven't been live in, I guess, in at least a week. So I've missed you all. All right. So we're just going to jump right in. Okay. So it was about a month ago, Dr. L, when we were talking about sex, and we talk a lot about, my channel is fully relationship content. Right. And I talk about getting back out here for the mature adult, those who have been single a long time, maybe divorce, starting over, sex. I definitely talk about sex. And we were having, Dr. L and I were having conversation about sex today. And when we were getting ready for that conversation, we were looking up some STD rates, right? And unfortunately, in the Black community, we see much higher numbers. And we wanted to have a medical professional on here to talk about, like, what can we do about these numbers? And first, we want to validate the numbers and what you're seeing as well when it comes to, and it's not done, doctor, it doesn't have to all, be about sex. It could be just about health as well, because we could be doing better, right? Okay, so first we saw 1 in 2, right, Dr. L? 1 in 2 African American women have herpes. And we were very shocked. We didn't believe it, but that came right from CDC. So we was like, well, hey, it came from CDC, and it came from, what year was that, Dr. L? Because that was a long time ago. Them numbers.
Oh, I don't know. I don't remember. I don't think it was that long ago. 2022, maybe 2021.
I think it was 2014. I think it was 2014, and that was a long time ago. That was over 10, that was 11 years ago. I think, because numbers, I'm good with numbers. That's the Chinese side of me, Dr. L, just so you know. But I'm good with numbers, remembering numbers, but not calculating and adding them up. Okay. But just good with remembering just random numbers. I think it was 2014. But anyway, Dr. Naima, so when it comes to our sexual health, are we seeing higher numbers in our community? And if so, I mean, why do you think that is?
Oh yeah, so absolutely. We're seeing high numbers in the Black communities. I think part of that is the mistrust that Black communities have in the healthcare system. So a lot of the times they may have, and I've actually had patients tell me that they may have had symptoms of something going on, and they just don't want to go to the doctor to be seen. And a lot of the time, they think that they have this trust in their partner. Oh, my partner looks good, and it's like, okay, looks don't necessarily equate to how healthy they are, or how, let's say, monogamous they are, right? So I think the mistrust is the main issue why a lot of Black men and women do not go to the doctors, not just for sexual health purposes, but just for mental health, for regular health in general. It's just a hit or miss when it comes to our communities, unfortunately.
I definitely understand that. So, I did a video about talking about sex earlier than later. Like, I'm one who believes in, talk about it on the first date. Now, Dr. L, as a man, if I started talking about sex on the first date, what would you think? Who you texting? You on this show, or you on your phone?
I'm writing down notes, V.
Oh, okay. Okay.
Dr. Naima, can you say something to this? Can you say something, please?
I don't want to get in the middle of it. I'm just here.
No, I mean, for real, Dr. L, you a man now, for real. Like, if we go on a date, our first date, and I want to talk about sexual health on the first date, what would you think? And or if you would think it's negative, how can I appropriately bring it up from a man's perspective?
Okay, that's a good question. What I'm going to think is, I need to stop by the gas station and get one of them gas station pills to take care of business, because I think it's on if you start talking to me like that. So
wait, hold on now. Hold on. First of all, gas station pills. I hope the hell you need to go see Dr. Naima. Don't be stopping it. What the hell they sell at the gas station?
You ever heard that, the gas station pills?
No, I've heard of it. I have. I've heard of it.
Dr. Naima heard. She heard the gas station pills.
Yeah. Okay. I don't know what's all in them, but I've definitely heard it before.
Well, let me just say it was a joke. So all I'm saying is that I think that if you go in there, then okay, then it might go there later on. I think that probably the first date, in all honesty, is probably too soon to talk about sexual health. So when was the last time you been to the doctor? You got any warts? You got any bumps? I mean, that's kind of too soon, I think, for the first date.
Oh,
so.
Okay.
Learn my middle and last name first. How about that?
Okay. But see, here's the thing, Dr. Naima, let me get your opinion. When do you think we should be talking about sexual health when you're introducing yourself, when you meet a new partner? When do you think we should talk about it?
So it's kind of hard to say an actual time frame, because some people move fast, some people are a little bit slower paced. I think for the most part, asking people to see their their status at some point. It doesn't have to be the first date. I wouldn't necessarily say the first date because, like Dr. L was saying, you know, you're going to be thinking, like, okay, so I know what's on her mind. But so I wouldn't say the first date, but I think if you guys have been communicating, even, you know, for maybe a few weeks or whatnot before the first date, and you happen to throw it in a text like, you know, so when's the last time you've been to the doctor? When's the last time you've been tested? I think that's a great way to do it, but not necessarily on the first date. But I think you should absolutely ask someone when's the last time they've been tested for something, because that's a huge reason why things are spreading, because people are not being tested. And not only are they not being tested, but if you ask for results, you know, when's the last time, you need to have some proof. Don't just go
Okay.
for what somebody says.
You okay? Okay. You say a couple of things. The proof piece. Okay. Now, Shedrick, I can't. I only have delete comment, put user in timeout. See, Doctor, I thought you said I could make him a moderator from here. How can I do
If you
it?
click on their thing, it should be make a moderator. It should be one of the options there.
Really? I don't have that as an option. I have delete comment, put user in timeout. That's it.
Okay, so if you hover over on the right side of it, you should see the three little dots.
Yep, and those are my options. Delete comment, put user in timeout. What do you have? You have
I got channel activity, go to channel, pin message, remove, put user on timeout, hide user, add as moderator.
Really? I don't have that. Can you add him? Can you add him as a moderator for me,
He
or
would be
it
on
has?
my no, he would have to
Oh,
he
he
would be
would
a
be for
moderator for me.
me, for you. How?
Yeah.
Okay,
You're
I'm gonna
clicking on the
figure
three
this out.
dots. You're clicking on the
Hmm?
three dots.
Yeah, I clicked on the three dots. I got three options. The last one is ban user
Wait a
individual
minute.
comment.
Are you on your YouTube? Are you on your YouTube or on your StreamYard?
I'm on StreamYard.
Okay, you got to do it on the YouTube. You got to.
Okay, let me go to mine. Okay, so
You got
I'm
to
gonna
have dual
go.
screens going. Yeah.
Hold. Okay. Well, that's smart. You so smart. Hold on. Let me see. Okay, but I do want to give me 1 second, and because I do want to mention. Let me see if I can get the Shedrick. I'm trying. Give me a second. I'm gonna see if I can add as. Here we go. Okay, I think I did it. Okay. All right. So here's the thing. I think sex. See, it to me when I was dating or going on dates or whatever. I think that it should be brought up on a first date, but in this way, hear me out, you two, in this way, because sex is a part of the relationship, right? And it's to me, it's part of the dating. To me, is an interview, right? Even though I'm not coming on the interview asking you questions like it's an interview. Okay, so what do you like to do for fun? Okay, check, check, check. I'm not check. Okay, go ahead. See, you get on my nerves. No, not like that, boo. But what I'm saying, sex to me is a qualifier, not what's your favorite position and all that other stuff. I'm not asking that. But for me, it's a qualifier. If we don't align in, let's say that you never, and I've said this before, Dr. L, you never use your mouth in certain places, then it's a no-go for me. Like it don't need to go on for me to go on second date no anymore because I'm disqualified. You go ahead. I'm not gonna waste my time and go back out with you. It could be so what do you feel about like oral sex? I mean, is that something that you don't do? Like if you say, well, I like to receive, but I don't give. Okay, well, you know what? Let me, that I told you that got to be on Instagram and you're blocked. And I'm gonna block you and I'm gonna leave the date, right? Because I'm just not gonna waste my time, especially if I have a long line of men wanting to take me out and I have my weeks and my days are very full. I don't have time to be wasting with people that I don't align. If he says, well, I expect sex 7 days a week, and I'm like, I'm good with 2 days. We don't align. I ain't gonna sit here and waste my time and be getting butt naked, or even trying to keep up with somebody who has to have sex 7 days a week. To me, it's a qualifier. We don't have to talk about it in such a way like, you like it in the morning or the night, Dr. L. I'm not saying that. So you can keep them little blue pills at the gas station. I'm just saying that I just want to see if we align. And if we don't, I respect that. And I'll be like, okay, well, I'm not gonna why waste my time?
I'm waiting to hear the doctor say this. What is your thoughts about
So I
this?
mean, when you put it that way, it's not a bad thing. But I also have to say, from a standpoint, from my standpoint, you kind of, when you go out with someone, I know as women, I know as me, you kind of know if it's someone that you want to be intimate with. Everybody that you go out with, you don't necessarily want to be, you don't get that, like I want to be intimate with them. So I don't know if that would be something I would necessarily bring up. Now, if it's someone that I'm like, I don't know, this might be someone that I want to do something with, then it might be able to be brought up. But for me personally, I'm not going to bring it up the first date. I'm going to do that
I
in some
respect
text
that.
messages, maybe a week before our first date. But yeah.
I respect that.
Yeah.
Let me ask you, V. Now, if a man brought up the same thing, if he said the same thing, however you said it, as nicely as that, what would you think about a man bringing it up? That same type of conversation.
I would, if we're talking in a mature way, then I'm okay with it. Now, if he's talking about what's your favorite position or what are you wearing? Do you wear things with your nipples out? Then it's a hard pass for me. But if you have questions about if we're aligned, if you have questions about my sexual health and when's the last time I've been to the doctor and do I believe in wearing condoms, I'm okay with that because I want to know those answers as well. Like I know that I'm a hypochondriac. I know that. I get real like antsy and I know like if you're not rocking condoms, you're not rocking up in this. Like I already know that about me. So I'm just if I would rather know up front that they, we don't align because I don't have a lot of time to be out here spending with any and everybody.
All right. What? But a man could say the same thing, right? If some ladies don't like certain positions, right? I mean, so why? Okay, it's okay to mention condoms, but it's not okay to mention sexual positions or what that mouth do.
Come on now, Dr. L. Don't
You
come on now. That's
brought
not
it
the
up.
same thing, and you know it's not the
You
same
brought it
thing.
up. You
No,
said
but
it, man.
no, see that, no, that's not the same thing. Okay, I'm gonna tell you. I'm gonna scroll down in these comments because I know. Let me see. He said we got to. Shedrick said, "Damn right, V. We got to see what goes and what shows. It shouldn't be a waste of time." Yeah, I'm not for wasting time. That's all. Like how many times I remember I went on a date with this man. 5 times I went out with him, and I think I told the story 5 times. And date number 3, I told him I don't think we are a match. I told him that, like I was trying to be honest. I was like, I don't think we're a match. He talked too much on the date. I don't even remember him asking me any questions. And I gave him that feedback. I said, you tell me all about your daughter and basketball. I was like, I don't think you know anything about me. So I said, I'm not going to go out with you again. He was like, give me another chance. I'm going to blah, blah, blah. Okay. I went out again. And then even again, he still same way. So you see what I'm saying? Like I'm not wasting any more time. I'm getting older, not younger. You can say what you want, Dr. L. That's okay. Depending on context, it's either Garrett says, depending on context, I agree. It's either highly promiscuous or a massive turn on. We're not okay. Look, we just heard Dr. Naima say that. I mean, it's a problem in our community. So we have to start thinking differently. What can we do differently? Right? We can't wait until now I will come on here and say, I've never had a one night stand. Call me prude, call me whatever, but I've never had one. Right. And so we can't wait until we get hot and heavy. Right. And then hormones are turned on. We can't wait to then. So then Dr. L and Dr. Spradley, then when can we have the conversation about what kind of cooties y'all got? Not y'all, but people got.
I was gonna say I don't have any cooties.
Not y'all, but people.
I was about to say, man, the English language, man, you got to be careful about how you put things in the English language there, man.
You're right, though. And I have a degree in English, but go ahead, Dr. L.
Oh, you're asking me? Man.
Well, either one of y'all. Dr.
Spradley's the guest.
I'm asking either one of y'all, because what
I think I answered it.
Oh,
doctor?
Okay.
Okay, doctor.
I think anywhere after the first date, I think it's probably good to talk about that because presumably you've had video chats, text messages, phone conversations, then the first date. Now, if you wanted to be a second date, I think, okay, now you start to build a little chemistry. So I think anywhere after that is probably a good time to do that.
Okay. Garrett, that's not what I said. I said a man can initiate that conversation as long as it's out of education, it is just for awareness, right? I do want to know, do you believe in going to the doctor? I do want to know, do you believe in safe sex? I want to know those things. Absolutely. Do you only have sex with women? I mean, that's a thing in our community as well. People not, Doctor, that's true, right, Dr. Naima? I mean,
Mhm.
I acknowledge that it's a problem. It's a problem. It's a problem. I did a
okay.
video about this that hasn't released yet, but it's a problem.
What's the problem? The
I think the deception is the problem. I don't care who you sleep with, but you got to let other people know. You got to let other people know. If you dipping and dabbing in both sides of the pool, there you should let people know. So,
What if you are sleeping with multiple people of the same sex?
should
Do
let
you
people
think
know.
you
Mhm.
think what if Dr. Naima, what if you're not exclusive? Do you think that should also be something for discussion? Like, should people tell?
Yeah, I definitely think so. I mean, even if we're not exclusive, I at least need to know, okay, you're sleeping with, how many other people you're sleeping with, because I still want to have the choice of, is this somebody I want to, take my chances with? Because, um, kissing kissing somebody is still being intimate and sharing bodily fluids. So you just need to be aware of what they're doing. And if you're not exclusive, then there's no reason not to be honest.
Okay, so that brings us to a question that we had, right, Dr. L, the kissing piece. We were having that question, like the transmission between what is it, herpes simplex 1 and herpes simplex 2, right? Can one be transmitted either way? You-
Mhm.
So,
So yes. So herpes simplex 1 is mainly what we see with cold sores. Okay, so it's typically benign. A lot of people can get it just from sharing utensils, from drinking off of somebody, from kissing, from using someone's lipstick, so that's more benign, but there's a fine line when it's now oral sex involved, because now it can then become herpes simplex 2, when you're actually putting your mouth in the genital area. But for the most part, in the medical field, we say herpes simplex 1 is above, um, pretty much the belly button, essentially. And then anything below is considered herpes simplex 2. And with herpes simplex 2, that's when you have more of the genital warts, that you'll see for men and for women, as well as blisters and sores, not only in the vaginal area or the groin area, but also in the anal area.
Did I hear you correctly? So if somebody has simplex 1, they go down on someone, they can give them 2, or it translates to 2.
No, so 2 would be if somebody already has like a genital herpes.
Oh, so somebody who has a cold sore or whatever performs oral on someone else, that would not translate.
No. So
Okay.
herpes simplex 1 is what we find in cold sores.
Okay.
That is not considered an STD.
Okay.
Genital herpes. Yeah, go ahead.
So that is, I guess, a large part of my question is, when we talk about 1 and 2, do we say black people or black women have herpes? Are they talking about 1 and 2? I just can't imagine 1 and 2 black women are running around here with simplex 2. That's just hard for me to believe.
So if it was from the CDC, then most likely they're talking about STD statistics, and herpes simplex 1 would not be considered an STD. Herpes simplex 2 would.
Okay.
So now I don't think it's quite 1 and 2, but I have to say that I know it's up there. I would say anything more like 1 and 5, not necessarily 1 and 2, but herpes simplex, or I should say the herpes simplex virus, is not what we do on our routine STD screening. So you have to ask for that particular test. We do the most common ones, even though herpes is common. I actually added on to my STD panels, but not every doctor does. Mostly the ones that we do: HIV, syphilis, gonorrhea, chlamydia. Those are the main ones. Hepatitis B and herpes are the two that a lot of physicians or providers in general do not add on to an STD panel, but they are highly contagious.
Why don't they do that?
It's just never been, I think it's more so it's never been the standard. And then once you kind of are trained a certain way, and the person that's training you, it wasn't standard during their time, you kind of follow suit. But for myself, I go off of what I see in practice. And when I see a large population testing positive for herpes, I'm going to check for herpes, just like Black men when it comes to prostate cancer. The recommendations for testing men for prostate cancer is they recommend against it. They recommend against testing men for prostate cancer with the PSA, which is a blood test. I, starting at the age of 40, will test my Black men for prostate cancer. I do it. You don't have to do it consistently every year if it's normal, but I do it because I know there are certain things that our communities are suffering from that are not being tested.
Very good.
Hold on. I'm gonna okay, I was about to just type this message to Yoli because I know we talked about you being a moderator, but girl, you gotta be on you can't be on Dr. L channel. I can't because I don't see her comment on my feed in my live chat. So I think that's how it works, right, Dr. L? Because I don't see her comment. Anyways, okay, so I know we had that conversation about the herpes simplex too. So here's my question, because I literally sat and thought about it. If the number is that high, what I don't okay, I'm not understanding how the number is that high for herpes simplex 2. Like, because Dr. L, if if you're about to have sex with a woman, and I'm going to pick on you, if you're about to have sex with a woman and you see some type of scabs going on, are you going to still stick your penis in there? Are you? No, you're
I
not.
am not. No, I am not. No, I'm not.
So it's got to be highly transmittable without evidence of source. Because if I'm seeing a penis, right, and I'm like, hold on now, that's a dry scab right there. That means it was something fresh right there, right? That done dried up, right, Dr. Spradley? Like, it's got to be transmittable when there's no evidence. Because I think people think that you have to have some type of sore, but who would voluntarily lick on a sore or or insert it?
And that's the problem. The problem is that majority of people will go years and never have an outbreak. So if you don't see anything, you haven't been tested for it, you've been tested for other things, you're like, oh, I'm clear. And that's why when I test men and women for herpes and they come back positive, they are floored, because they're like, no, I've been getting tested regularly. And I said, you've probably been getting STD screens done regularly, but you haven't been tested for this. Or if you have, you may have recently come in contact with someone that transmitted it to you.
Okay, are there, well, we know the obvious symptoms, right? The obvious symptoms for herpes, but are there some pre-symptoms that people can be aware of? Like, because I've heard of getting contracting HIV, like you get that flu-like symptoms, like so is that the same for herpes, catching herpes simplex 2?
No.
No.
So like I was mentioning, most people will never know that they have it. So actually pregnant women when they become pregnant and we do our first, well, it's considered your second trimester screening test, herpes is on there, because the problem is a lot of women will never have an outbreak. A lot of men will never have an outbreak and they don't know they have it. However, if you are pregnant and you vaginally deliver a baby with it, that baby will have herpes, and it is horrible for babies, for newborns. It is a horrible, horrible situation for newborns, which is why they do that screening early on to make sure that you don't have herpes. And the only time you can deliver vaginally is if you have no active outbreak. If you have an active outbreak, you absolutely have to have a C-section with that baby.
Wow.
I've seen where some babies have died, right, from
It's horrific, like the things that can potentially happen with a newborn that has herpes.
Jeez.
that's see, Dr. L, are you is this making you think about maybe some
No.
Magnum? Oh,
No.
okay. So, doctor, okay, I'm not gonna put your business out there. If you like to share with Doc, you already shared with the YouTube community.
I shared it with you too. We talking about putting my business. You've been hinting around it all night.
I'm just saying, Dr. Spradley wasn't on that YouTube. I'm just saying, like, doctor, I ain't gonna share your business. You already shared it. You might as well go ahead and reshare it.
Me and I are having a conversation after this show. I want y'all to know that. So
our pillow talk. You don't have to share, boo.
No. I'm just trying to prepare for the scolding I'm going to get from the medical doctor here. So I am very hesitant to use prophylactics because I cannot perform when they are on. So there you go. But I get tested. I have the latest tests on my phone. I'm willing to take another one. I'll pee in a cup, draw blood from my vein, whatever you got to do to get it. I am absolutely 100% clean. So
you just need to make sure the other people are. So that's why you gotta have.
Yeah, absolutely.
Don't go off of. I'm just saying. Some people go off of looks, and it's like, no, I need to see the paper, and I need to see the date on that paper.
Have you heard? Do you know a lot of not professionally? Do you know a lot of men who have that type of issue where they cannot perform when they are using?
Yeah.
So I'm not the only one there, V.
No.
And there's a lot of women too. There's a lot of women who don't like them as well.
I never said boo. I never said I was a fan either. Okay, but I rock them if need be, or I just keep my coochie to myself. Like I just don't participate. Yeah, but no, I tell you, condoms for women, like, you have a different feeling, as wearing it. For me personally, I do feel like they pull at my walls. I feel like it's like kind of tugging. Like there is a different feeling. I'm not saying that I'm a fan of it either, hun. But being that I am a hypochondriac, and I'm gonna make sure somebody has one on.
So, I mean, I guess, from a mental safety position, what V is saying is correct, right? But what would you say to someone? And I've had ladies tell me the same thing. Well, they told me it just flat out hurts. Like, they don't maintain their lubrication, just, So what would you advise people who just don't like to use them?
That's a risk that they have to take. That's just a risk that they have to take. There's not much to really say. If now if it's an actual allergy, then that's a little bit. Sorry, 1 second. If there's an actual allergy, then there's lambskin, there's other alternatives. But if it's just I don't like it because of lack of lubricant or whatever the case is, then you just have to be willing to take that risk.
Okay.
I'm just well, okay. So I know the thing about the lambskin. I know we're older, right? Yeah, we're older. Well, we are, Dr. Spradley. Dr. L and I older, and my I'm postmenopausal, so I ain't getting pregnant over here. But I know if you are worried about pregnancy, I don't think that the lambskin condoms are an option, and right because
Even
I
for
think.
HIV, right? Don't they not
Oh
work for
yeah,
that?
it's true.
Hmm.
Yeah.
Yeah.
But if you have an allergy and you want to try to do something, then that's
Mm,
your option. But
mm.
Just take the test. I mean,
But the test though, okay, no, let's clarify that up since we have medical doctor here. You take the test. It's not how accurate is the test? Let's say that you got exposed 2 weeks ago. How accurate is the test then? Like what window should you take the test? Because, you know,
that's a good question. So actually for HIV, doing it further out is the better option. Now for chlamydia, for gonorrhea, for those type of things, a lot of the times it can present within a few days. You may feel symptoms. But for HIV, you can take a test the following day, even that same week, and it show up negative, and it doesn't mean you're out of the clear. So typically I tell patients to wait a few weeks before they actually take an HIV test, because that's when it's going to be most accurate. If you do it too soon, it's not going to be as accurate.
so a few
see,
weeks, 4 weeks. I used to hear
Yeah,
six
I
weeks.
say anywhere from 4 to 6 weeks, honestly.
6 weeks. Okay.
4 to 6 weeks, Dr. L. That would be me. That would mean no coochie for 4 to 6 weeks, right? Since you don't want to, wrap up, you'd have to, like, the woman should wait 4 to 6 weeks. Will you meet somebody on a dating app or wherever? That woman gonna have to hang in there for at least a month and a half before y'all get butt naked. Just in case you were wondering that, like
It'll be worth it.
it would
Unless
be.
she was recently, if she was recently tested and she's like, I haven't done anything. I mean, like I said, once again, it's just like a risk that you have to take. You go off of if that person is being honest. And then if they had blood work, let's say in the last week, and they're like, I haven't done anything.
Mhm.
It's a risk. Either way it goes, it's a risk.
Mm.
But you just got to be willing to take that risk if you want to.
What about the rate of transmission, let's say through oral sex? Is it possible for let's say HIV? Is it possible through oral sex? Transmitting.
So typically not through oral sex. If the person has a cut down below, let's say they were shaving and they have a cut down below, then absolutely blood can put you at risk of, um, but you have to have a cut as well. It has to be blood to blood contact.
Mm.
But from oral sex, I gotta be honest, I haven't seen
Come
it from
across
oral
it.
sex. Yeah, I haven't come across that. So I don't want to give any inaccurate, information. So I'm just gonna say I'm not aware of that.
Hmm.
But I do know blood contact and then of course intercourse.
Now, Liz, right. Okay. So, Liz, you bring up a good point. The too much friction, too much dryness, right? So, here's the thing with like the video I did about sex after 50. And I suggested, like, coconut oil is a great lubricant, but y'all, you cannot use coconut oil with condoms. You cannot use a lot of those lubricants with condoms. They will degrade the efficacy of a condom. So, you will have to use like the terrible products. I don't promote it, but KY jelly. But you can get irritated coochie from that stuff. So I did a video where I tried all these. I used my coochie as an experiment, and I tried a lot of those products for Shush your mouth, doctor. It's on my page. It's on my page. It's there. I tested out some vaginal moisturizers and I tested out some vaginal lubricants, right? Just to see which ones would work, right? And one of the aloe, like people tout the aloe as a version, as a not virgin, but as a version of a lubricant. But aloe irritated the heck out of me. Like it irritated my cooch. So when you talk about using condoms, like there aren't any. And if you're dry, like you don't got that many options besides KY jelly and a lot of spit. Doctor,
Well, you do. So, well, if you're dry due to hormonal issues, like
okay, let's talk about it.
perimenopause or menopause, of course, your estrogen levels dip way down to, almost non-existent levels. And in that case, you do have an option of HRT, which is hormone replacement therapy. And so specifically for vaginal dryness, you can use estrogen suppositories. So you don't have to take a pill or a patch. You can actually just use a gel in that area when you are going to be active. So that is an option if your vaginal dryness is due to hormonal reasons.
Hormone. The menopause thing, I talk about that because I'm postmenopausal and I am on hormone replacement therapy. And I just want to give it a try. And I would have never ever considered it had I not put that information out there with the menopausal symptoms and so many people resonating with that information, which led me to have medical professionals on here to talk about hormone replacement therapy. And using that information, I was able to take to my doctor. He ain't like it. He got fussed at the second time I went, and I see him tomorrow. But he didn't like. I don't know, and I think I worded it well. I was like, well, I had a professional on. He pretty much was like, well, since you do YouTube, and since you got all the information, and I was like, hold on now, I'm just trying to say that I've learned about this, and I'm coming to see you. But he wouldn't give me the one that you insert, the estrogen that you insert. And yeah, he said, try the patch. He didn't even check my hormone levels, nothing. He said, just go try the patch and the progesterone. And then, and I didn't like that. It didn't sit well with me. So I called back, like the next week. And I said, no, I want the estrogen that goes in the vagina. I said, I want that. And he was like, well, no, and I said, look, is it my coochie or yours? I said, vagina. I said, is it my vagina or your vagina? Give me the damn estrogen. If I'm asking for it, just give me the estrogen that gets inserted, because the patch is your whole body, and I was like, well, the only issue I was having was with the cooch, so I'm like, just treat the cooch, so I'll do a video on the update of how the HRT, hormone replacement therapy, is going.
What about, I've been hearing about a lot of women drinking okra water. Is that helpful at all, or have you heard of that, doctor?
I've heard of it, but go ahead.
So I've heard of it. I can't give you any numbers, but I've heard that it helps as a natural lubricant for women, like, I guess, making them a little bit more wet down below. I don't know how true it is. I haven't had a ton of patients mention that to me, but you hear people that try it and they say one thing. So I really don't know how accurate the okra is. I mean, it looks slimy, I know that much, but I don't know how accurate it is with actually being a lubricant or making you, more wet down below.
Okay. Cedric said, hang in there. He sees your face.
Bro, yes. I'm trying.
Hang in there, Dr. L. You should know me by now. So Yoli says she ain't got no problems with, girl, you better thank your lucky stars. Now, Cedric did have a question. Does menopause affect the sexual side for all women or just some? Oh, that's for you, Dr. Spradley.
I'm sorry. Does menopause affect the sexual side for all women or just some? So just some. Yeah, just like with any menopausal symptoms, not every woman is going to be affected, even with perimenopausal symptoms. Not everyone is going to have hot flashes. Not everyone is going to have vaginal dryness. Some women will have absolutely no symptoms. But because of your age, that's an indicator for us to check hormonal levels. And that right there will give us an understanding if you're in a menopausal state or a postmenopausal state. But some women will have absolutely no symptoms. So vaginal dryness will not affect every woman.
Do you deal with men's sexual health?
I don't. Yeah, I don't know too much about men's sexual health.
Okay.
Are you about to ask questions about ED? Not to say that you have that, Dr. L. I mean, that's a sexual health question for about men.
I used to think that you were doing it accidentally. Now I know that you're doing it on purpose.
No, I'm not. Okay, what other sexual health question, Boo, for men?
Yeah, throw it out there. I may know a little bit about it. Throw it
She
out
doesn't
there.
deal with that. She doesn't deal with that.
You
Okay.
go ahead and throw it out there.
I was going to ask the same type of questions, right? You're talking about the hormonal issues that women have when they reach a certain age. Are there hormonal issues that men have, and what should we do about it?
So the only real hormonal issue I see with men is their testosterone levels can drop some. Now, it's not a drastic drop like how estrogen is for women during menopause. But of course, when you have low testosterone, that will affect you in many ways as well. So that would be the only one that I can think of hormonally that will affect men. That will affect their sex drive. That will affect their fatigue level. It will affect a lot.
Okay.
Excuse me for 1 second.
Go ahead, doctor. Okay. Well, she got to do doctor and stuff. Dr. L. Yoli says she want me to leave my boo-boo alone.
Yeah, man. Why you picking on me since we're picking?
You know, I got nothing but love
Before
for
we
you.
came on, y'all, she was picking on me. I want y'all to
Yep,
know that.
because I was like, you break up with me? I still love you, Dr. L. What about your medical questions?
I was gonna ask her. There she is. I want to ask you about you kind of mentioned this before. Talk about the distrust that people of color, in particular African American people, have with doctors, and is it helpful when they see a Black doctor?
Yes, absolutely. So of course the mistrust goes all the way back to the Tuskegee experiment, right? With syphilis, right? So I think it's just been kind of a generational thing that has been passed down, and actually even patients that I see that are of the generations now. So what's that? Where are we at? Generation Z? Like where
Girl,
are
don't
we?
get me to lying. I don't know.
The age are like 14-year-olds or something like that. Generation A, right?
Yeah, like so like the really young ones, even the early 20s, they will come to me and they'll say, you know, doc, I just don't trust, you know, certain doctors because I don't feel heard. They think that I'm exaggerating my symptoms, or my symptoms are not real. They're not, you know, really going on. And so if you're seeing that at the age of 20, that when you go in for a concern and you are being kind of pushed to the side, that's getting instilled in you early in your 20s. So then as you go to your 30s, you kind of have that trauma in the back of your head, and then it just kind of follows you. And I see it with all the ages. It's, you know, I deal with a lot of women, so they all say the same thing. Their pain is not considered real. Their symptoms are not considered real. And so when you feel like you're not being heard on a consistent basis, you're not going to want to keep going back to the thing that's bringing you trauma, right? So that's why there's such a huge distrust. And it's the same thing for men. I don't know. It's just for Black communities in general, they don't believe that our symptoms and our pain is real. You know, I know we are, you know, mighty and strong and awesome and amazing, but we have real things going on, and we know our bodies. We know when things are not right. So if we are at the point where we're coming to a doctor, there's a reason why, you know? So I think that's why there's such a mistrust, because people are not being heard, and they don't feel like other races can relate. So when they see a Black doctor, they're like, okay, I know she can relate to things that are going on with me, because there's certain medical conditions that are more prevalent in Black women and men. Our symptoms are different presenting than in our counterparts. And so, you know, we can, like I I did a talk about heart disease with women, and it's not like how we see in the in the TV. Oh, I'm having chest pain; it's radiating down. No, it can literally be fatigue that doesn't go away. It can be stomach pain. It can be back pain. It can be things that you don't even connect to your heart to realize that, oh, I might be having a heart attack, which is why heart disease is the number one killer of us Black women, because we don't present like how our counterparts do. So that's why knowing that you have a doctor that understands, okay, I'm not going to present, I'm not going to present like, Susie, sorry, but it gives you a sense of trust and you're willing to open up.
Mm-hmm.
Does that trust also go towards the, what's the best way to put this, like the machine of going to the doctor's office, right? You go to the doctor's office, you sit there for a little bit, you get called in, you're there for 3, 4, 5 minutes, they take your stuff, and then you tell them what's wrong, and they prescribe you a medication, and you're out the door in 15, 20 minutes, right? Therefore you don't feel heard as well. Does that continue to add to the distrust?
Oh, absolutely. That's why I worked in the big medical corporations and organizations. I did that for 10 years, and I saw how it became a money-making business. Mm-hmm. It was about, at this point, we need you to just see as many patients as you can in the shortest amount of time that you can. Yep. So I saw within that 10-year time frame of practicing with them that it went from 30-minute visits to 15-minute visits to 10-minute visits. And I'm like, hold on. No, this is not how I practice. I like to build a rapport with my patients, which is why I actually, when I opened my own practice, it's considered a direct primary care practice. And that particular model of primary care is where you have not only direct access to your doctor, my patients have hour-long visits with me. I know their names. Mm-hmm. They can text me if they have a concern. And I don't take insurance. I don't deal with the insurance at all. And the way that I'm able to have this type of practice is not dealing with insurance, because insurance, what they're going to do is so much paperwork. You got to spend most of your time on paperwork, and you can't do what you need to for the patients.
No, you're right. I had a hormone replacement specialist on the show, and that's exactly what she said. She doesn't take insurance because she said exactly the same thing you said. Like, the insurance requires you to see as many patients as possible, and you're not able to really find out what's going on with your patient. You got to go through so many people so fast that it's unfortunate. Dr. L, you and I have had this conversation about leaving this country because of the medical care. Like, that is what our country has come down to. Like, people aren't getting the greatest health care in here. It is 100% all about money. So yeah, it's like you have to start your own private practice to be able to serve your patients correctly. Like, you didn't have a choice in order to, if you want your patients to get great care, it's unfortunate. You got to go outside of the insurance system. That's terrible. That's where we are in our country. We ain't gonna go down that road, but it's unfortunate, because I was asking her about where are the menopause specialists in the area. Like, I'm looking and I couldn't find any of them that accepted insurance. Right. And then one at the doctor's office I go to, they talking about, well, you can get an appointment with her in 3 months. 3 months. I'm like, girl, I be done flew back to Malaysia and got on some kind of hormone replacement therapy and came back to the damn country, been on the damn medication for 3 months by the time I see her. So it's ridiculous. I know, Mimi, you asked a question up here. I think you asked, like, where do men, is somewhere up there, where do men go for, is it their sexual care? Do they see, I think, Yoli, you said a urologist. Is that where men would go for their sexual health care?
Mm-hmm, that's correct. So either their primary care, but the specialist is the urologist.
Sorry, my dog is about to bark. And I was trying, I'm getting down to the questions here. Oh, I see. That's nice. Yeah. Build a rapport. I think that's so So important. Sorry, I'm probably gonna have to go on mute for a second. Doctor, you might have to take over for a minute because I think my dog's about to really bark.
Okay. I wanted to ask a question about if we can go back to the people sleeping together. How many people are in your practice or that you know of? We talked about letting people know that they're sleeping with each other. I mean, is that a real thing where people are like, oh yeah, okay, you're sleeping with Jim Bob, I'm going to sleep with you too, right? And they're just kind of they don't care. Do you think that that's a very prevalent thing within the community, which is causing STD rates, that they knowingly
Yeah.
are doing this?
Yeah, I think so. I think, honestly, I feel like some people don't care. And then, like I said, honestly, some people, I've actually literally had people say to me, but doc, she looked good. She smells good. Okay, that doesn't mean everything is good down below. So sometimes people actually go off of appearance and think that a person is okay. And it's a little bit of ignorance in a sense, because just because somebody is put together doesn't mean that they take care of themselves, right? So I think it's a little bit of not caring, a little bit of people not being honest, but people also not asking for proof. Yeah, so and then just a lot of people sleeping with the same people. I don't know how this world could be so small, but it just seems like, there's yeah, there's people that are sleeping with the same people, and they're just kind of passing things around like a yo-yo, just passing it. And believe it or not, the HPV, human papillomavirus, that is the number one STD in the US. So it's not even, chlamydia was up there, and chlamydia is not far behind it, but HPV is the number one STD currently. And men don't get checked for that. Women do with pap smears, and that's how they know they have it. Once again, warts is what you see down below in the genital area for HPV, but some men may not have that. They may not have warts, and that's how it can get spread.
Now, HPV can lead to cancers. It can lead to anal cancer, cervical cancer, and oral cancer,
Yep,
right?
head and neck cancer. Absolutely.
Yep. So a man going to get a screening, he should absolutely, I would think he should absolutely ask if he if
Yes,
he can get checked for that.
absolutely.
Are there tests for
Absolutely.
HPV? I don't know. Are there tests?
Yeah, yeah. So there are tests for HPV for men and for women.
Mm. And I think one thing's important is that don't assume because she's not out there, in the streets, or she may have had one or two partners, that she is also I don't want to say clean, but free of STDs, right? Don't assume that as well, because I've seen videos of people who said, I was only in a marriage, I was only married to him, but that man was stepping out, and he could have been playing both sides of the fence, or not, but that man was stepping out, and then of course brought it home to his wife, and she was doing the right thing. She was being faithful. So we can't make those assumptions about people because she looked good, smell good. Oh, she's in the gym 7 days a week and she eats her damn vegetables. That you like that she would be 100% clean. And him, oh girl, he got six-pack abs with his nice cut body and his 6'5" frame and all this other stuff. He ain't got nothing, girl. You don't know. So we gotta wrap it up. Okay. And I see Yoli, I know you're answering a question from Mimi somewhere. Not for the okay. I must have missed the conversation. I apologize. I'll be trying to keep up, but I'll be skipping a bunch of messages. Mimi said what? Yeah, I thought that's when they experience issues, not for regular checkup appointments. Um, okay, let's see. Also, HPV can go undetected for years before showing positive on the test. Is that true, doctor?
That's accurate. And actually,
Mm.
outside of that, HPV can resolve on its own. So the body can resolve it.
That's
Of
what I thought.
course,
Yeah. That's what I
yeah.
thought. Yeah.
And so that's actually, so back in the day, we used to do pap smears as soon as a woman became sexually active, a little girl. People start in their teens at times. And we found that a lot of unnecessary testing or procedures were being done because these children, or teens, I should say, were testing positive for HPV. So what they started doing is the recommendations now are the age of 21, you start with pap smears. It does not matter if you were sexually active starting at the age of 14, because what they started to notice is that HPV can kind of clear on its own. And so it just saves having to do extra procedures for these young teens. And so that's why the recommendations are now 21, but typically it'll clear on its own. If it doesn't, there's definitely procedures that can be done to make sure it doesn't lead to things like cervical cancer.
So does that mean that can it or will it? I mean, is it 100%? And if not, I mean, does that, I mean, I got my daughter that vaccine. Was that a waste or?
No. So I never say vaccines are a waste, because what vaccines do is they decrease the possibility of you getting it. No vaccine is 100% going to stop you from getting whatever you're getting vaccinated for. So that's what I always tell people. You're never, just because you get vaccinated doesn't mean that you're never going to get what you're getting vaccinated against. What you're getting a vaccine for is to decrease the risk or decrease the possibility of you actually getting whatever it is that you're being vaccinated against.
And I believe you
That's
can
why
get
so
that.
many people have
Okay.
had COVID and they had the vaccine. I've had the flu almost every year, and I get vaccinated every year. You're trying to lower your risk of developing it or getting it or whatever the case is, but you are never 100% completely out of the woods with it.
So, Black Lexicon asks, can a parent request a screening, and I'm assuming an STD screening for their underage child?
Yes, they can.
Mm.
Yes, they can. Yeah,
Okay.
they're under parents,
Mm.
or guardians
Mm.
care up until the age of 18. Now, after 18, they don't have to do anything that the parents want. It's up to them. But up until that age, they can absolutely request it.
What do you?
I know.
What are your?
Oh, go ahead.
Go ahead. Go ahead.
Well, this was kind of a different kind of question, because a lot of us are older. A lot of us have children who are over 18 now. And because of that, like the parents really don't have any input or any say so into their health. So, should all parents get some type of medical directive or something for their child so that we can still have a say so? Like, how does that work when a child, becomes an adult and they hit 18 and it's like we have no more say so over their health or input, right? And let's say they're not married, they don't have a spouse, right? So, what would we parents need in order to be able to still provide some type of input into their health, even though they're an adult?
There's nothing, just like, kids can go out on their own at 18. There's no actual medical document that you can sign saying that, you still want to have free range and, whatever medical care for your child. Once 18 hits legally, we cannot allow parents to make decisions for 18 and above. We could get in trouble for that. So me as a physician, if I have an 18-year-old in the office and mom is like, no, I want her to get tested for gonorrhea and chlamydia, and she's like, I don't want to get tested, I have to go off of what she says, the patient, because that's who I'm treating, and she's considered an adult at the age of 18. Now, if she's 17, mom can make that call, and I can go with what mom says or dad says. But once she hits 18, she's considered an adult. Legally, there's nothing that we can do.
Okay. Mimi has a question. Dr. Spradley, will a couple where one was diagnosed with HIV have to always use condoms, even if the person is on medication?
So no. So there are medications, of course, prophylactic medications that partners can use as well. But once the person becomes non-detectable or undetectable, then you can have sex unprotected with them. Do I recommend? You won't hear me recommend it, because I never believe anything is 100% unless you're just not doing it.
Mhm.
And that's just my point of view. And so I feel like you're running a risk, even if it's a half a tenth of a percentage, you're
Mhm.
running that risk of getting something. But according to the literature, once a
Mhm.
person is non-detectable, you are not at risk of developing HIV.
You know, you got a lot of those women now, or men too, but I see the community talking about black women, y'all just go ahead and get on that PrEP, right? Do
Mhm.
you see a lot of women are now just getting on it, who are out here dating and being sexually active? Are you seeing that in your practice?
No, I'm not seeing. Number one, people don't want to take pills. I
Mm.
can't even get them to take a blood pressure pill. So,
Okay.
let alone taking a PrEP pill.
Mhm.
So, most people, I mean, if you are extremely sexually active, then if you're really promiscuous, then yes, I do see that. Or for men that are
Mhm.
homosexual, I see that as well. Specifically in that community. That's where I
Okay.
see it the most. But I don't see women, and let's be honest, women are out here doing things, okay, doing lots of things. But I don't have women coming up to me like, "Hey, Dr. Spradley, I want to get on this PrEP because
Mhm.
I'm sleeping with 5 men."
Mhm.
They take that risk. And that's why
Mm.
there's so many issues going on in our community. They take that risk. But like I said, in the LGBT community, I definitely see it quite often asked for.
Now, is the PrEP, has it been proven effective in
Yes.
preventing? It has.
Hmm.
Okay. Is it does insurance cover that?
Yes. Insurance does cover it. Now, let me bring that back. So certain insurances will cover it.
Okay.
There's been so many changes with insurances. If you have good insurance, maybe like a Care First, then most of the time they cover majority of things. I thought at some point Medicaid was covering it, and so I don't know necessarily. I really don't know. It would be something you would have to, take up with your insurance to see if they cover a portion of it, if they cover it fully. But it should be covered. But
Mm.
there's a lot of things that should be covered that are not.
Mm.
So at this stage, I don't really prescribe PrEP.
Mm.
I've taken a course to be able to prescribe it, and I've prescribed it in the past. I don't do it so much now, and so
Mm.
I don't know necessarily if it's a fighting battle with the insurances with coverage.
Well, then I guess the bottom line is what, Dr. L? The bottom line is we got to be out here practicing, you know, um I think you know what it really is? I think you got to practice discernment. Everybody doesn't deserve access to your body, period, no matter how good they look, right? Everybody doesn't deserve to receive or give you their energy. So we have to be out here being very, very mindful of who we interact with on a, sexually. And I'm gonna still stand on, I'm gonna ask the questions up front because I need to know. Like, I'm just not gonna waste my time with people who don't value, their energy as much as I do, right? So, did you Rhonda says, if someone is undetectable for HIV, how does that person advise their sexual partner? If someone is undetectable, how does that person advise their sexual partner? Do they not say anything? Do they say that they tested positive for HIV but they're undetectable? Mm. Is it legal, like, if you know, I, do you have to disclose it?
So that's a good question. If you're non-detectable, I don't know if you need to disclose it. legally.
Mm-hmm.
If you are a person that actually cares with a heart, and cares about the next person, then you'll be honest. Undetectable does not mean that you can't become detectable at any point. Yes, you're taking drugs to help you be undetectable, but that's why in my HIV patients, I have to check those viral loads every 3 months, because that can change from 3 months of being non-detectable to maybe this particular medicine is not working for you no more and we got to switch you to something else. So you absolutely should be disclosing anything that can be life-changing for someone else, because like I said, you can become detectable at any point. If you miss a dose of the medicine for a few days, you can become detectable. So you got to make sure that that person is being consistent with taking their medicine appropriately to make sure that they remain undetectable. So just because you're undetectable today doesn't mean 3 months from now you're undetectable if you went on a vacation and forgot your pills at home for a week.
See now, Dr. L, what do you now? Okay, see, are you siding a little bit with me by asking these questions up front? Like, because now I see I'm gonna have to rephrase my question. My question now is going to be, do you do you know when's the last time you've been tested for HIV? And not only are you negative, what's your status, but have you ever tested positive ever?
Are
With
you
somebody.
detectable right now? Can I detect you? Can you spit in
Yeah,
this
like
cup?
has because I don't want it, because they'll be like, well, no, because anybody can easily say no, I don't have it. Well, because in their mind it's undetectable, but in my mind, nah, ninja, you didn't have it at some point. So it's like, were you ever born? Like, if you ask a woman, were you ever born a man with the penis? Like, we gotta ask, like, because sometimes people. I have seen people switch up questions. Well, you never asked me. Now it's like, well, how was I supposed to know you like to have sex with baby rabbits? Like, but they don't, people share what they want to share and then they twist it based, they twist the answers like, well, you never asked me. So I feel like you have to ask every question up front and as creative as possible. Right. And, hopefully, like you said, Dr. Spradley, people are honest, but if we know if people are honest, then we wouldn't have such high rates in our community if people are honest. So y'all go ahead and not ask them daggone. Audience, I'm telling you,
We didn't say
ask.
that, V. We
No, I'm
didn't
saying
say
I'm
that.
asking right away. I don't give a damn what you say, Dr. I'm telling you right now. I'm asking right now. First date. So so what college you go to? Oh, okay. How
What's
often
your
you go
viral
to
load
the
count?
doctor? What'd you say, Dr.
I said, what's your viral load count? I mean,
Yeah, put that on a piece of paper too. Yeah, and then don't. I'm gonna tell you right now. Look at the app. So whatever medical app that they have, allow them, because do not get a piece of paper. People can alter PDF files. I've seen it. I've seen it. Do not rely on that. Right. I want you to log into your app with your date of birth and your birthday and your password. I want to see it. Okay. Now don't send me no daggone file that you can create in Canva. Okay. No, I want you to I want to see it. We gotta be. You can say what you want, Dr. L. I mean, I would suggest that to anybody. We can't play about our health, right? What is it? Herpes and HIV. These are things that you gonna carry to the next person, y'all. So you gotta come on now. Let's have enough. He said, log. That's right. Log into your my chart. I know, Rhonda, you ain't lying. Log into your my chart right now. I want to see it. Bring it up. Bring it up. That thing's available 24 hours a day. So, Dr. Naima, I want you to go into whatever you like to bring up tonight for the audience. Like, I know that you focus on stress and burnout, and we know, y'all, that stress and burnout will absolutely, Dr. L, she may not study male penises, but we know stress and burnout will cause things to go, just kind of go like this,
I
right?
don't know. I don't know. I don't know how we would know that.
I'm just saying, not maybe you, maybe not you personally, maybe not. I don't know. But either way, but I could sit here and tell you from having conversations with medical professional, stress can cause that. Stress can cause a dry coochie. Stress can cause all kinds of things when it comes to our sexual organs. right? But other things. So you, Dr. Naima, what can, because you said earlier about Black women and a heart disease, and that is and it's a silent killer in our community. And I'm sure a lot of that is coming from stress.
Yeah, absolutely. Stress is one of the main issues when it comes to heart disease. Especially, I was just looking at a story where a 29-year-old had a stroke that nearly took her out because she had no idea that she was walking around with high blood pressure.
Mhm.
And that's one of the major causes of heart disease, uncontrolled high blood pressure. We're thinking we're okay and we're not going to the
Mhm.
doctors. That comes right back around to the mistrust, not going to the doctors to truly see what's going on. Next thing you know, you're in a situation where your life is almost being taken away, so
Mhm.
stress is absolutely key when it comes to heart disease. But most importantly, when we're under stress, our cortisol levels increase, and that's that hormone in our body that is kind of like our fight or flight hormone. So if we were in a dangerous situation, we would produce large amounts of cortisol to try to figure out how to get out of the situation. And so when you're constantly in stress, you're constantly producing large amounts of cortisol, which will keep you in that fight or flight survival mode on a daily basis. And
Mhm.
cortisol causes your estrogen levels to go down.
Mhm.
And so that's something else that leads to low libido, vaginal dryness, because that it's kind of what we see when we're going through menopause, right? And believe it or not, when our estrogen levels are low, specifically when we're going through menopause or even perimenopause, so heading into that, heart protection, estrogen is a natural heart protectant for us women. So as we're going into menopause and our estrogen levels dip way down, we're starting to lose protection, heart protection, due to the low estrogen levels. So that is another reason why we're seeing heart disease as well. So it's just kind of one of those things. It's one of those things where it's a domino effect essentially. And so yes, when your estrogen levels are low because you're constantly exhausted from burnout,
Mhm.
your libido is going to go down, your sex drive is going to go down, your energy level is going to go down, you're going to experience vaginal dryness, you're going to have mood swings,
Mhm.
okay,
Mhm.
which doesn't make being intimate very exciting. So it's a lot of things that come along with it, and this is something that I talk about with my women that are in my mentorship program, which is called Thrive and Rise, where I help them with burnout, because burnout it really affects a lot of different areas in your life, not just the physical but also the emotional, the mental. So
Mhm.
it's a lot of things that burnout can wreak havoc when it comes to in your life.
Mhm. I believe it stresses. Well, let me ask real quick before I ask this question. I wanna honor your questions as well, just for anybody watching, because I see high vibe. You said your blood pressure was high. You had no idea. Can you just give some common symptoms of somebody who may have high blood pressure?
So high blood pressure is hypertension is considered a silent killer. That's what we consider it in the medical field, because you can have absolutely no symptoms.
Mm.
Because what happens for a lot of people is they may be having high blood pressure for quite some time and their body starts to adjust to it. So the only time they will really, really experience something feeling off is if their pressure is at stroke level,
Mm.
or what we consider a hypertensive emergency or urgency. And that's where you can see blurry vision. That's where you can have an extremely bad headache. And so those are the common symptoms that we'll see, the vision changes and the headache when those numbers are extremely high. But for the most part, it's the silent killer because people are walking around with high blood pressure and not even knowing it.
Could people go? You know how they have the blood pressure machines in the grocery store? Do those work? I don't know. Do they be working?
Mhm. They do.
Mm,
Now, I don't go off of just one reading. That's
mhm.
why I tell people I have a blood pressure cuff at home, even if, and I don't have high blood pressure, but I'm like, I need to be checking because I don't know. And
Okay,
so,
good point.
yeah. And so it's good to have a high blood pressure machine at home where
Mhm,
you can occasionally just throw it on. I'm not saying check your blood pressure when somebody that made you mad and you ready to fight somebody because your pressure is going to be high.
mhm.
Don't check it if you just ate, some pork rinds or, some Old Bay seasoning, which
Mhm,
are high in sodium. Don't check
mhm.
it because, of course, it's going to be high. So you want to check it when you're in a relaxed state, typically closer towards the end of the day, because in the middle of the night is when our pressure is the lowest. It's the highest in the morning because things like cortisol actually
Mhm.
help us to wake up in the mornings. And so that's going to raise our blood pressure. Why? Because that's our fight or flight hormone.
Okay. Okay. Now, just ask a couple of quick questions here. Black Lexicon asks, have you ever had to, I guess, do a consultation with the legal team about including periodic STD screenings as part of a prenup? I don't know if you've ever heard anybody asking for a periodic STD. That's a whole lot of no trust in that relationship.
Right. I'm like, you sure you want to marry this person?
But
If you have to get
I get
legally
it.
Welcome.
involved for that.
I get it. I get it. Because people out here, if only everybody were faithful and just kept their legs closed. Let's see. Okay, I know High Vibe said that her blood pressure was real high, y'all. Yes, if like Dr. Spradley just said, yeah, I'm about to go in here or order. I've actually have the opposite. I have low blood pressure and it's
Mhm.
been like really low before I know, and they ask, do you know you have low blood pressure? The doctor will ask me and I say yeah, because it'll be like 90 over 60. It's been a 80 over 50 before, and
Mhm. That's
it's
low.
just low. Yeah, and it would tell me that to consume more sodium, and like I can't get dehydrated because then I'll get dizzy and stuff, so I have
It'll
to
go
make
even
sure.
lower. Hmm.
Mhm. And let's see, I wanna high blood pressure also impacts the kidneys. Yes, it does.
Absolutely.
Um, okay, Rhonda, good that you have Imma get one too, girl. Imma get one too. Dr. L, did you have any questions? Like, we don't wanna keep Dr. Spradley much longer. Do you have any questions for her?
I think we kind of ended off with, well, my question would be, what are your thoughts about just everything we talk about, blood pressure and all that, just diet and exercise, and where does that, how often should Black folks engage in that? Are we engaging in that enough? Would that help many of our issues, medical issues, high blood pressure, type 2 diabetes, et cetera, et cetera? How would that help that?
Yeah, so absolutely. So actually, Black women and men, we are the highest amongst all other races when it comes to obesity. And of course, obesity kind of falls into other things that we're at risk of already, which is high blood pressure, type 2 diabetes, all of those things. So, absolutely, you should be exercising. And at a minimum, 3 days a week. I mean, there's 7 days out of the week, and you'd be surprised. Some people don't exercise at all, never,
Mhm.
and they
Mm.
expect to lose weight or they expect to be the healthiest person they can be, and they're not really pouring into themselves. They're not being intentional about their health, but they don't think that exercising is going to do anything, when in true actuality it does. Number one, it's helping to strengthen your heart.
Mhm.
Number two, it's helping to keep your lungs nice and strong. Like, these are all organs that, believe it or not, as we get older, these things change, and sometimes we don't like to know that we're aging, and how those things affect us as we age if we are not doing the correct things, like exercising, and eating healthy, eating a diet that is rich in omega-3 fatty acids. That's like your salmon, avocado, things like that. Healthy fats. Those are things that help to decrease your risk of high cholesterol, which decreases your risk of stroke. or heart attack because high cholesterol, clogged arteries, So eating healthy and exercising go hand in hand. It doesn't matter if you're 20 years old or if you are 70 years old. My mom, she's in her 70s and she's doing yoga every single day. That's
Mhm.
how she feels as good as she does at her age. So you have to be intentional about your health if you want to stay around long enough.
Mhm.
Very
Okay.
good.
Well,
Thank you.
we know diet and exercise helps with so many things. Like, and people underestimate I know somebody said something about giving medical advice. I was like, diet and exercise. I was like, you can look on the back of a cereal box and they tell you like diet and exercise is something that we all need to be doing, period. Because I believe in energy and I believe in the flow of energy. In order for that to happen, you have to have movement. So I know Dr. Spradley, you also, I don't know if you want to mention about your would do the word retreats. Or did you sell out your retreats for the upcoming?
Yes, so actually, outside of my medical practice, I really, really enjoy doing different events for empowering women. And so I host different brunches. My last brunch was in April. I actually have a award ceremony coming up August 2nd. Called the Best in the DMV Black Women of Excellence Award Ceremony. And this is where I'm going to be giving women, Black women, awards for being who they are. I'm not
Mhm.
talking about having a fancy degree or these big titles. You deserve to be celebrated for being who you are. And so I have two different awards. I'm giving the Unstoppable Woman Award, which V is a recipient
I
of.
sure am.
Yes, you are. Well deserved.
Yes.
And then I have the Worthy Woman Award. And I'm just really excited to be able to offer these type of things to women because we deserve it. We don't get celebrated enough
Mhm.
unless there's a true achievement. Look, we are the gift. We are the
You ain't
achievement.
lying.
Okay.
And we are out here, y'all. We are out here doing things. So
Yes.
that is for sure. And I believe this talk tonight. Look, some now let me see if I pronounce it. Emetfetulu. Is that, did I say that right? Well, look, they went out and checked your blood pressure like last time we went live. When was that? And Cedric went out and started exercising, right? And that is so important. And that's why I'm on YouTube, because y'all, we need to take better care of ourselves, period. And I know you mentioned the obesity thing. I'm not even going to touch that tonight, because I've heard from so many of my male clients that say, Black V, I want to date a Black woman, and we're at 50, but they say a lot of Black women are overweight. And if I'm active, if I'm in the gym, I want to attract a woman. Again, we're older. I want to attract a woman that's also physically fit and in the gym. So we talk about that another time, y'all. So get out here, do some exercise, eat a vegetable, right, Dr. L? Eat a vegetable.
Or two.
Mm-hmm. Or two. Okay, cut back on fried chicken. Y'all can stir fry some chicken. Y'all need me to teach y'all. You know I'm half Chinese. I could teach y'all how to stir fry some chicken. I don't fry no chicken. So any closing words, my two beautiful guests, my two doctors. Y'all, I got two doctors on the show. Anything, Dr. You ain't got nothing to say?
I'm just glad to be here. Thank you so much. You provided some great information. Thank you so much. Thank you.
Yes, thank you, Dr. Spradley.
And
Uh,
thank you for having me. This was a great experience. I love, giving knowledge as much as I can and just walking in my purpose. So I truly appreciate the invite on here. And I just want to let people know you can definitely follow me on Instagram at Refresh Health MPC. And also I am on Facebook at Dr. Naima Spradley. So definitely follow me because I'm always dropping jewels on both of my platforms because I just love spreading the knowledge.
Thank you. Okay, so hopefully everybody can see your name here. I will update the description to put your contact information in there. Dr. L, I'll tag you in yours too. I will tag you in the video as well. But do you be tagging me when you be, because we're on each other's channels. So
I tag you
hopefully,
all the time. Why would you say
okay.
that?
Okay, thank you, boo. I appreciate that. All right. Well, good night, everybody. Thank you as
All right,
always, y'all,
your
for
phone's
joining.
about to ring here because
I'm gonna block you real quick. All right. All right. Thanks everyone for joining. Until next time, y'all. Take care.
right.
Night.